Welcome to the Heart Rate Variability Podcast, where we explore the exciting science behind heart rate variability. The material discussed in this podcast should not be taken as medical advice. Please check with your medical provider to make sure any suggestions or strategies are right for you. Visit us at the OptimalHRV.com website to learn more about the Optimal HRV app, download a free copy of Matt's book, Heart Rate Variability, and also get show notes and additional resources around heart rate variability and its applications. Welcome, friends, to the Heart Rate Variability Podcast. I am here with Dr. Dave Hopper today, who I have met in person now. So we spent last week at the AAPB conference, biofeedback conference in Irving, Texas. And so I got to meet Dave in person. Kind of odd thinking of someone as a good friend and then getting to meet them and hanging out with them at the booth all week. So Dave, it was great to meet you in person. I would love just to start out, because we're going to talk about a presentation you did, but I know you and I were a little bit out of our element, so to speak. I think we felt really, well, I think I can speak for both of us, felt really welcomed by the conference. Always when you have a booth, there's, are you just here to sell me things? And I think that took like 5 minutes getting to know people to kind of shake that off and just feel welcome. And I would just love, as we walked into the biofeedback world, my first time for sure at the conference, I know yours as well. I would just like, what was the chiropractic experience? What was sort of your experience walking into this new environment?
Well, first of all, it was awesome to meet you in person for the first time too. As my wife and I joked, you guys are real people.
Yes.
So that was a relief. But that was a lot of fun and very cool to see how well the whole team actually clicked in real life. But as far as the conference, it was great. I have to say the psychology and biofeedback world, they are great people. I couldn't have felt more welcome. I imagine you felt the same way. And there was no, oh, wait, you're not one of us kind of feeling at all. They welcomed us in with open arms. And I absolutely loved that. And just the conversations that we got to have and the further invitations that we got as a result of being there, really says how much it was mutual, the feeling of good vibrations. Yeah.
And we were joking around. Ina is probably asleep still. She, as a member of our team, boy, I think I was just glowing with pride to be associated with Dr. Hazan at that conference. Not only did she give the keynote, and I think I can talk to you pretty safely here. We were both incredibly honored to co-present with her on workshops. And so we gave her this week just really to sleep because she was on probably 6 days straight. And this conference was no joke because they started like 8:30 and went to about 10 o'clock each and every night. So I know I was exhausted. I know you were exhausted. So I can't imagine how she was as well. But it was really great to, as we, I know, have just fallen in love and respect Ina to death, to even learn more from her at this conference as well. So that was one of my real joys last week too.
Absolutely. Seeing how people react to her was really cool. And yeah, like you said, I can only imagine her exhaustion. I think she spoke at least once every day, if not multiple times. So yeah, she was a very busy lady at this conference. So
absolutely. Well, one of the reasons why she was busy is because you all did an amazing presentation. Probably my favorite 90 minutes of the entire conference. on heart rate variability, biofeedback, and pain. And I thought one is you and your third presenter, which I know you'll mention as well. One thing, you can't have a great workshop really without people that will keep you awake. And boy, all three of you were great presenters. And so both engaging, but really fascinating from the different perspectives that you had around this issue. So I just kind of want to turn it over to you to maybe introduce the topic a little bit better than I can, but maybe talk about a little bit about the presentation. And I'd love to follow up on this topic with you. So sort of introduce what you talked about, who was there, and then I got some follow-ups.
Okay. Well, to begin, it was myself. Then there was Dr. Brad Lichtenstein, who is a naturopathic doctor. He spoke alongside me, and then also there was Dr. Ina Kazan. And so we all talked about our different views on chronic pain and how we approach chronic pain using heart rate variability. That was that was what our talk was about. So I'm not going to speak on their views exactly because we would love to have both of them on and talk about it themselves at one point. But I would be more than happy to talk about the chiropractic view and how I use heart rate variability and biofeedback for treating the chronic pain.
So let me, one of the fascinating things that and I paid a lot of attention to this because I deal a lot with psychological pain, and I don't think anybody in the psychology world would argue that often manifests as other sort of physical pain. So, and let me start out with what seemed like a really dumb question, but I think it's a little bit more complex than a lot of people think. What is pain?
Oh, well, that's
so easy, right?
It's yes, quite the complex question indeed, because that's going to be a totally different experience for each one of us. What you consider painful, I might consider pleasurable. What you consider painful, I might not even notice. It is 100% a subjective experience for each of us, and that's where it does get into the psychology of it. And as well, where we can say, as I talked about a lot in my presentation, where we can't always use pain as our sole guide to how we want to treat a patient, because it is not a reliable indicator in most scenarios.
And talk a little bit about that, because I mean, there has been, there's been a push by big pharma over the last decade or so to include pain as a vital sign. And boy, did that get us in a lot of trouble and was part of the mess we found ourselves in and the horrifying situation with the opiate epidemic. So on one hand, you had big pharma pushing pain as a vital sign right up there with heart rate and blood pressure and weight and so on and so forth. And here you come in and say it's subjective. So I think a lot of us have been sold on, no, pain is something we can scale, and that's a scientific measure. So from your perspective as a medical provider, you're telling me no, that's pretty subjective. So I'm assuming you're not probably saying, using it as kind of that vital sign in that way, but how do you approach this? Because I imagine when I go to a chiropractor, one of the reasons I do is because of pain.
So thank you. And yeah, it is a very sad case to let pain be your guide for much of anything, because pain, just like if your stomach hurts, whether you have a headache, anything like that, it's an indication that something is not right, but that's all it is. So when we pull back and say, okay, well, what exactly is pain telling us? Well, first of all, it's telling us, hey, say you broke your arm. It's saying, hey, don't use that arm anymore. In that case, it's a great thing because what do we know? If we want our arm to heal, we have to not use it. So in that case, pain is doing us some wonderful favors. Same with a stomach ache. If you have pain after you ate something, it's saying, don't eat that again.
Right.
This was a problem here, or figure out what else, could have been going on. And that is the biggest thing when I have a patient come in who is in pain or has been in pain. I always say, okay, so pain is something that we have going on here, but that's just the tip of the iceberg, right? So pain is going to be one of those symptoms, and symptoms are the last thing to show up with a problem and the first thing to go away with a problem. And when we look at it with that perspective, we go, okay, well then what is the real problem? Where is the rest of that iceberg? So now we're going to look for the root cause. And when we were talking about stomach aches, when we were talking about headaches, how are we going to figure that out? And that's where really talking to our patients, really getting to know our patients, really getting to understand their entire lifestyle is going to help us understand why they are actually in this discomfort. We can't just say, well, your stomach hurts, here, take this to cover up the pain.
Yeah.
Well, then you're going to continue hurting yourself in the same way. You have headaches every single day. Here, take, whatever non-steroidal anti-inflammatory that you're gonna take to cover up this headache. And you know what? That's not really going to get you anywhere. It's going to get you on a cycle of taking those NSAIDs every single day at the same time, and you're going to end up with very damaged internal organs, unfortunately, as a result of that. So that's where I'm looking at this. I'm saying pain is just that check engine light beginning to flash. And now we have to go in with our diagnostic equipment and figure out exactly where this problem is.
Interesting. So I just kind of want to throw the psychological pain in here, because I think that's an interesting transition into talking about the heart rate variability piece of this, because one of the functions of trauma is to kind of help you not get into that situation again. And that is one of a very complex issues. But if I realize that, let's say I have medical trauma, so I go in for a procedure and maybe my surgeon thinks I'm knocked out, but I'm experiencing it and I have that trauma. The trauma is helping me say medical providers can be a source of pain and suffering. I need to avoid them from now on, which can also get us in trouble. And, a lot of times when we talk about, trauma as well is, that self-medication too. Now, sometimes that turns into drinking or drugs to help medicate the pain, because a lot of times for psychological pain, one of those painkillers, which we are learning more and more about, that we should minimize as best as possible. Talk to your medical provider, but is kind of that avoidant thing. So in psychology, there's a real easy connection between pain and heart rate variability, because pain is very, very easily connected to stress. And even traumatic stress. And obviously we know stress impacts sympathetic, ventral vagal, parasympathetic functioning. So let's say I got a bad ankle sprain. So, as a basketball player, that was something I was always dealing with. I've got pain there. And I kind of wonder how you see, that connection, like we do in psychology, of psychological pain as a stressor. How do you start to see, like, I did do something to my ankle. How do you start to see this, and how do you use heart rate variability to look at both, maybe from an assessment, but also from a healing perspective as well?
Well, excellent point, because there is, obviously there is the psychological pain and the psychological fear that come along with these things that can be just as real. And after all, that's really all that matters, is what is real to the patient in front of you. And anyway, what we would see regardless is we're going to see their heart rate variability change quite a bit. Now, if we have data on a patient leading up to this, leading up to whether it be an injury or an emotional trauma, or anything like that, we're going to see that their heart rate variability changes. And of course, this is going to be for the worse, right? We're going to see that score lower, because now rather than, being in that outright, I'm in my safe environment, you're pulling back, you're pulling out of that ventral vagal state into that dorsal vagal state. And I talked about this in my presentation as well. I used a case with a guy who had who was in a motor vehicle accident, and he suffered severe migraines thereafter. And that was the biggest thing was, Matt, I believe you would recall, he had super tight muscles through his neck and into his skull. Mm-hmm. And like I said, nobody ever told those muscles that he was safe.
Yeah.
Nobody ever told those muscles that they could relax and stop doing their job of protecting. And that is why this guy suffered with migraines for as long as he did.
And I got to break in there for a second, because I did interrupt you during the presentation, even though I really wanted to. It just would have, it was more for me than anybody else. But, when you said that, I just like, yes, because one of the things we talk about with trauma, which I think is sometimes hard to discuss because it doesn't always show up as a physical injury like you were talking about, but we talk about untreated trauma, and it sounds like the accident probably was psychologically traumatic for the individual. When you looked at all those symptoms, I'm like, yeah, those are what we see with the psychological trauma. Obviously with an accident there was probably some physical things, but we talk about trauma before treatment is still happening in the body. It's still happening to the nervous system. And so when you said it was still happening to him, he was still almost in the accident. And I just thought that was such a cool thing to connect when we talk about the psychological symptoms, and we know those manifest physically as well, and have paid a lot of attention to that. I was like, oh, Dave just kind of really hit it out of the park of, you're seeing that from a chiropractic, examination assessment, but just so perfectly mirrors what we talk about psychologically as well.
Well, yes, because they are one and the same. Just because we're not talking about, his brain reliving the experience, his body is reliving the experience.
Yeah.
And those things are stuck in our body just as much as they can be stuck in our brain. Yes. So even though he may consciously be like, yeah, it was a car accident, it's no big deal, his body is still living in that moment. And we can see that because we can palpate those muscles and say, yep, there it is.
Yeah. And looking at his heart rate variability, his daily readings were, as a metric we don't like to use much, but as just curiosity, started out well below, I believe, if I'm remembering correctly, population norms, but not sort of for somebody that was active in their life, owning, I believe, a martial arts gym, if I'm remembering correctly, somebody that was really active that you would expect just on paper, maybe a few years back, was probably outperforming population norms, had a really strong heart rate variability. I mean, that's a guess looking at, pre-accident lifestyle versus post-accident. But you could actually see that in some of his baseline data.
Yes. And that's in a perfect world, everybody would have been measuring their baseline HRV for months prior to their trauma.
If only everything was set up like a study. Yes.
Right. Unfortunately we don't know what he was before. But I'm in a fortunate situation where at my office, I get to put people on an HRV monitor for at least a week prior to me seeing them. Yeah. And that provides me a ton of information, because here's the thing. If Matt comes into my office today and he says that he's in all this pain and, and whatnot, and I get an HRV measurement of him today, and then I treat him today, then how did my treatment affect that next week of his heart rate variability reading? So we wouldn't have a true baseline. So in this case, we have, of course, an estimated true baseline of where they are at in their, injured physically or psychological, or psychological injured state, where they are at. And then when we begin our treatment, we can really start to see how our treatment is affecting change within this person's nervous system. And that is the big picture. So we know, like you said, he was in the low 20s. He wasn't doing hot. And then when he started a new therapy with me, and we were doing, like I said, I treat from a whole human perspective. So we're not just doing one modality here. We're looking at this guy's entire lifestyle, and this is for every patient. We're looking at their entire lifestyle and taking everything into account, because it all matters. Yeah. Because when it comes to your nervous system, there is not just one part of your life that matters. Right? Just because you're getting headaches or, whatever it may be, that's not the only thing that matters to your nervous system. In fact, it's measuring everything that happens within your life. So if you're having headaches, but you're eating horrible food and you're not sleeping great and you breathe through your mouth, say, and you don't exercise or do any form of movement, okay, well, then we're just doing one little thing here, and man, there's a lot of hay on your back. So to take off the one straw, it's not going to help much.
Right.
That's where we have to approach every patient with this multimodal treatment plan. So anyway, what we can see looking at his heart rate variability, and this is something I do with nearly every patient, is now we have a measurement of how that's working. Yeah. So I can see on a day-to-day, week-to-week, month-to-month basis how this treatment plan is working. And I can start to say, look at that. We are affecting positive change within your nervous system. And a quick disclaimer there. When you start something new, it is a strain on you, whether it is great for you or horrible for you. It is a strain nonetheless.
Yes.
So in a lot of cases, you will see an initial dip. And that's where the subjective experience comes in. Okay, yes, your heart rate variability went down, but are you feeling better? Yeah. And are we seeing other positive improvements from other objective measures and other subjective measures? That's where we can rely on that. And then we start to really see that kick back up and go in the positive direction. And then throughout care, we use that as our guide. We use HRV as our primary guide. And what we're doing is, we know that if Matt came in and we're seeing him trend in the positive direction, and then all of a sudden Matt starts to dip, and we go, oh no, what happened? And then we can start to look, we can start to question Matt, and what was Matt tagging on his readings as that was happening? If we have Matt journaling in some way, what was going on in life? What can we recall from that started to push Matt in a negative trend, and vice versa. Yeah. What in life was happening if all of a sudden we see you really start to take off in a positive trend, more so than what we would expect? What's going on there? Because we want to know so that we can adapt our therapies in whatever way to help maintain a positive trend or, pull you out of a negative trend.
Yeah. So with your, it's interesting is one of the things, and this is somatic therapy that really comes from, and I think this fits really well with the heart rate variability science. So it is, in psychology, we have emerging best practices, and then you sort of hit a level where you're a best practice. There's enough data, there's enough track record there. And somatic therapy is sort of, hit that best practice level. And we talk a lot about that, and I would love to get your perspective on this. With this case specifically, is that if you're in a spot where you can't act out the fight or flight response, like that is one way we hold trauma inside of us. Like you weren't able to act out, you weren't able to kind of do anything to release that. There's a great saying in neurobiology that zebras don't get ulcers because the stress of the zebra is a lion trying to eat the zebra. Well, what's happening during the potentially traumatic experience is the zebra has activated the flight response. So when the zebra escapes the tiger, they've kind of burned off that. So they can really then go back to regulation because they already got that. And I wonder just kind of, that's the language we've been using. And so some of the somatic therapy is sort of acting out, well, not sort of, it's acting out what you would have liked to have done. So if you were stuck in the car, to do it and do it like vigorously to activate that, maybe jumping up and down where the shoulders are really moving while you're kind of recalling some of those experiences. And I just kind of wondered, as you look at this case, it sounded like that was some that you were helping through chiropractic care too, and probably stretching and other things as well, sort of helping to almost release that trauma, both physically and psychologically, and measuring that with heart rate variability.
You know what, Matt, I really appreciate that because I have never really looked at it from that lens. So I love that perspective. And I'm sure you've read the book, Why Zebras Don't Get Ulcers.
Yeah.
Awesome book. But to look at it through that lens is totally different. And can we say that that's, in a way what I was doing? Well, absolutely. But I've never looked at it that way. So I greatly appreciate that. It's another, and that was, for all the listeners here, that was the power of being at a psychology conference,
yes,
presenting about what I do. Is at the end, I had one of the top researchers in the field actually stand up and make a suggestion to me in relation to a type of therapy that I was doing and how a breathing technique could help with that. And that was so cool because again, it was something that I would have never even considered because through my lens, I haven't seen that.
Yeah.
And through my schooling, it's not something that I would have run across. And that's the power of an interdisciplinary practice, and sharing ideas with other professionals is that you do get this other, oh wow, and your mind just expanded. So thank you so much for that, Matt.
Awesome. Well, that was sort of my follow-up because right after you, Ina took the stage and talked, sort of about how biofeedback. And again, I think this kind of sets how we look at pain is how breathing does help with pain. Whether it's pain you're going to experience, and there's reappraisal and, mindset and a lot of other stuff as we try to torture people ethically during research studies, which I always think is like, hey, your foot is going to go into this bucket or your hand is, whether you like it or not. Like, and of course you and I would say, oh, we know this will increase our heart rate variability. This is going to be good as somebody who does sit in an ice bath every once in a while for my wellness. So I think we hit that other ways, but I want to look at this case and maybe we talk about this generally, not this specific individual, but so you have somebody that's showing probably some psychological pieces of the trauma. You talked about his relational, how he felt as a father, how he felt as a husband, how he felt occupationally, like, there was that social psychological side of this, obviously the physical side, which was, that initial reaction, those wellness pieces. But here's somebody, let's say you just got this person walking in today, now that we both have this amazing expert in our life on resonance frequency breathing. So how the heck would the breath help this case? That if this person would practice, whether it's mindfulness, RF rate, learned a lot more about that at the conference. I've been a huge fan of it, really syncing up your breath with your heart rate. That's kind of the Matt's simplification of this, but, really kind of breathing exercises on steroids until I find a better analogy to use for that. So help me understand from the physical perspective, why would 20 minutes breathing at this magical RF breathing rate, how would that be a variable to help an individual like the one that you were seeing in the healing process?
Yes. So I want to, I definitely want to answer that because that's a very important piece. But I also want to hit the first part of that, which was some of the psychological piece and how it was affecting his family and his life. And that was, what as I said in the presentation, is the why. Why today did this patient come in to see me? And that's the biggest question that I have to ask, especially in the case of a chronic pain situation, because when we talk about chronic pain, you've been in this discomfort for several years, decades in some cases, right? But you chose today as important enough for you to walk through my door.
Right.
Why? Yeah. And that's the question that we have to ask. What changed between last year and today? What changed between yesterday and today? What changed that it was significant enough for you to finally say, I'm going to deal with this? Right. And that's the, arguably the biggest thing when it comes to the healing process is they don't really care about the pain, right? He could have dealt with these headaches forever. He was dealing with them already for, 3 or 4 years, debilitating headaches, migraines. So you've been dealing with it for that long. Obviously, those aren't the reason you came in, but what changed? And when we started to dig into that, when we start to, really dig into the patient, it's that the overwhelming letdown that he was having with life in general. He was no longer the person that he used to be. He was seeing that he was no longer able to participate in the things that he loved in life. He was no longer able to be there for his kids and his wife the same way that he used to be able to. And as I said, he was so tired of seeing that look on his kids' faces that he was letting them down.
Yeah.
And I mean, how many times do you have to see that as a father? How many times do you have to see that before you finally say, you know what, if this is what, I have to change something about what I'm doing. I have to change something about my life. And this isn't just pain, right? This is what it comes to with addiction, with any of that kind of stuff is when do you finally say, you know what, the way that this is going is not right. This is not serving me anymore. Yeah. And in his case, that was it. He said, I've had enough of letting my kids down. I've had enough of letting my wife down. So now he wanted to start that treatment. Now, that's when he finally had enough. And again, it's in the cases like that, it's not the pain that brought them in the door.
Yeah.
So anyway, that was, sorry, we got deep there for a second.
Yeah. I like that.
But with the RF breathing, so when we talk about resonance frequency breathing, what we are talking about is a breath rate at which you are most stimulating what we would call the baroreceptor reflex, or essentially the where our heart rate variability is going to be at its highest, at its peak. So we are seeing our breath in sync with our heart rate. That's what we're lining up there. Unshameful plug, our app is the only app out there that does a resonance frequency assessment, which otherwise you would have to go have done in lab. And again, we had this weekend, amazing things happened. Yes. And one of the top researchers in the field came up to us and said, hey, I tested with your app compared to my lab equipment, and it gave me the exact same frequency.
Yeah. So, we got some huge, it's kind of our coming out party, and to see how excited folks were about that functionality, which I know our tech folks have busted their butts on over the last 12 months. So I'll just give a shout out to Ben and Viv on that work, because Ina's got a lot of brilliance, but to manifest that in a phone app, lots of props to Ben and Viv. So
Yes, indeed. They have been workhorses. Well, really, the whole time I've known them.
Yeah.
But especially as of late.
Yeah.
So when we get into that resonance frequency breathing, though, what it's doing, you're literally training your HRV, and that's what we call it, HRV training. So you're breathing at a slower than typical rate. So it is somewhere between 4.5 and 7.5 breaths per minute, is where, or I'm sorry, 4 breaths per minute to 7.5.
Yeah, don't miss the 4.0 people.
Team
4.0. I swear we have the best RF rate, but I don't have any science to back that up. So
well, I'm 4.5, not too far behind you.
You can aspire. You can aspire to join the team. So
one day I'll be that cool.
You're in the farm league. You're in the farm league.
Yes, exactly. I to get to your status, man, I have to grow like 6 more inches.
Yeah, exactly.
And Matt is significantly taller than everybody.
Yes.
For those of you listening.
Yes.
Anyway, so you can determine that resonance frequency, and it's a 14-minute assessment to figure out what your optimal breathing rate is. And once you have figured out what your optimal breathing rate is, then you can do training at that breathing rate for anywhere from 2 minutes to, I believe, 30 is like the limit on our app. And personally, I do that once every day, first thing in the morning, for 20 minutes. Actually, it's more like 25 because I do it with a meditation. And it's a great way to assist with your meditation, which is also something that you can do on our app. This is just turning into a commercial.
But
it is wonderful. As far as meditation mindfulness, it takes it to the next level. It really does. And when you're doing this RF breathing and stimulating, and training that heart rate variability, these are lasting effects. It's not like you just have this change for this one moment and then you're back to regular life.
Yeah.
These are lasting effects, and we see that people who are doing this training have this as a lasting effect, and also just doing this breathing, especially paired with mindfulness and meditation, you can feel yourself changing in the way, in your outlook on life and everything. The guy cuts you off in traffic and you go, as opposed to you are, it's you literally feel yourself calming down and looking at life through a different lens. And in the case of somebody like the car accident guy that we've been talking about, signaling to your body that it is safe, signaling to your body that it can enter that ventral vagal state, that you can be calm, that you can let go, that it is okay. That's what you're doing.
Yeah,
that is a big part of what you're doing with this. So yeah, and as I said in the presentation, unfortunately, I didn't know Eno well enough at the time, or I would have had him doing this as well, because it would have been amazing.
Yeah.
But,
awesome. I just kind of wanted, as we wrap up here, any is way more of an expert than I was in the audience. Any other insights that you got from your co-presenters? Because it was really an all-star packed session. So I just wondered, from your perspective, as kind of being sandwiched in between these two other brilliant people. And like I said, it was like really my favorite 90 minutes, except for like the 20 minutes I got to talk. And that had nothing to do with your presentation. It's just, I love to talk. So, but it was definitely the top in this 2 hours, that 90 minutes. So I wondered, if there was any other sort of insights that you had being sandwiched between two other great experts.
Well, first of all, I think that everybody needs to know that the talk that you and Ina did was amazing as well. And I'm hopeful that we'll get a chance to hop on and talk about that at some point as well. But yes, being sandwiched between Dr. Brad and Dr. Ina was amazing. Now for Brad, what I noticed, as a naturopathic doctor, was how cool it was. And with Ina as well, was how cool it was that all three of us coming at the same problem from different angles.
Yeah.
We all had such a similar overall approach.
Yeah.
And that was so awesome to see. And even though we're all in our own separate fields, we all look at this problem so similarly, and we even use similar language. We did not trade slides before.
Yeah. That's amazing, actually, because I would have assumed preparation, even because it flowed that easily from an audience member's perspective.
Yeah, we all three did. So we talked about the format of how we would set up the talk, but we didn't talk specifics about what we were going to say or anything like that. And yeah, it was just unbelievable how much overlap there was coming at it from three totally different perspectives. But again, coming at it from three perspectives that are looking for a root cause, as opposed to treating a problem. And then the fact that Ina and I both picked a case that was migraines was also kind of funny.
Yeah, exactly.
But yeah, it was amazing, and in a bit unfortunate in that regard. I know, well, Matt, you're never nervous because you talk for a living. But sitting there, I was watching Brad's, and I'm like, oh, this is so cool. And I was like, oh my gosh, I also can't focus because I'm thinking about what I'm about to say. And then you get up, and then after you talk, you're like in this surreal cloud, and you're like, what just happened?
Yeah. Especially with that audience, because it was not, there were probably about 3 to 4 times more doctorate degrees in that room than the typical room I speak in. So, yeah.
That was quite the intimidating room.
Yes.
When you're talking to, when you're presenting to the people who created the research that you are presenting, that your whole practice is based on.
Yes, absolutely.
Yeah.
Pretty cool stuff. Well, Dave, this was a great topic. I'm so glad we got a chance to kind of share your perspective with this. And and we got some exciting announcements coming up. We're trying to get a show with Ina soon. Got some big announcements on our end. I'm going to hold back, delay gratification for talking about that, but we'll see how long that lasts. So we'll be jumping back in your feed soon. But thanks for everybody for joining us. Heart rate variability, you can find us at HRV or optimalhrv.com. Also on YouTube, if you want to see Dave and I talk while you listen to us. So thanks, everybody. We'll see you soon. Dr. Dave, as always, a huge pleasure, my friend.
Absolutely.